Hey guys, hey medical divas, hey students out there. It's your girl, that clinical instructor. I'm going to do a little impromptu live lecture tonight. Wasn't planned like I normally do, but I figure any time is a good time for education. Every moment is a good teaching moment. So, as you see, this time is a little bit different than my other experiences, and I'm not quite as, bubbly and peppy, and I have no makeup on, and I'm looking a little bit pale because for once now I am the patient. Give you a little background. I'm a type 1 diabetic, and those of you that know me well also know this, and I have been my whole life. Um, Being diabetic forever, unfortunately means that we sometimes have some complications. And so a few days ago, I started getting sick. I had gotten an infection in my kidneys. Well, the infection in my kidneys actually started a couple of weeks ago, but I've been kind of battling it on and off antibiotics and whatnot. And so finally, it kicked me in the butt and it ended up putting me into something called diabetic ketoacidosis. So diabetic ketoacidosis is a condition where your blood becomes too acidic with DKA, which is actually possible in both type 1 and type 2 guys. It's not just a type 1 thing. People tend to think that it's just a type 1 thing, but it's not. It can happen in type 2. But it's a lot more common in a type 1, unfortunately. Um, so with this, your blood glucose is entirely too high. Your body is actually starving itself and it starts breaking down tissue that's actually way important, not, the fat like we all wish it would break down. It breaks down things like muscles and organs, stuff like that. So that creates a imbalance of your acid base balance in your bloodstream. Your pH drops very low, bicarbonate drops very low, your anion gap gets high, all sorts of terrible things happen, and basically you feel like you're dying. So symptoms of diabetic ketoacidosis are things like an acetone or a very fruity smell to the breath. This is not my first rodeo with DKA, unfortunately, and I've actually been in emergency rooms where I've had new nurses and first year residents saying to the attendings and charge nurses, "Oh, she's drunk. I smell it on her breath." And they're kind of chuckling, going, "No, that's not alcohol you smell. That's acetone. She's way, way ketoacidotic." So you'll find that fruity or acetone kind of smell. The patient tends to have a very dry mouth, they'll have dry skin, they're vomiting like uncontrollably. There's no intractable vomiting in the world like diabetic ketoacidosis, I swear you. And they do something called Kussmaul respirations. So when your blood gets too acidic, your body is going to do whatever it can to try and correct that acidic environment because it's potentially fatal. So one of the things it's going to do is try and blow off excess CO2 to try and bring that pH back up. It's called a buffer. So your patients will do something called Kussmaul respirations or Kussmauling, and it kind of looks like this. And it looks like you've just sprinted or you're running a marathon. That and it'll get worse when the patient exerts themselves. But when I say exert themselves, I mean like going from bed to chair, attempting to walk to the bathroom, talking too much, things like that. So when you see those things, and of course, a very high blood sugar. So when you see those things happening with your patient, you're going to suspect diabetic ketoacidosis. So the thing that you see right here in my neck, this is a triple lumen. As you can see, it is 1, 2, 3 little ports. And this is actually in my internal jugular vein. This is a central line. This kind of goes down into the, more scary central venous system. This is a wonderful thing for somebody like me because unfortunately being diabetic as long as I have, my periphery is kind of on the shot side. It's not a whole lot of fun. So I was so dehydrated and so dry from such severe diabetic ketoacidosis that I was in that all my veins were just flat. They couldn't get any sort of peripheral line in me. They couldn't even get an external jugular, which is an IV in the external neck veins, but isn't usually considered a central line. It's actually external. This is actually your internal jugular. So this is the central line. The complication with a central line like this is that it's prone to control. So this little thing that you see here around where the tube that goes in, where the catheter goes in, is called a biopatch. And it's actually this little patch that's impregnated with antibiotics and helps reduce the risk of infection. These things are at a high rate for infection. They can cause things like clots, and if they're not put in right, if you advance it too far and it ends up in the ventricle, you can end up with, arrhythmias, ectopy, stuff like that. So and these are the things that we see. So the dressing on these is usually changed, depends on the facility's policy, but the places that I've worked in the past, these are changed every 72 hours, which is not a whole lot of fun because it's a big old dressing with a piece of tape and you can see it's kind of stuck in my hair. That's really painful taking it out, actually. And once it's in, it gets sutured into place. So that's my little rundown here with my DK experience. So I'm feeling much better than I was. Believe it or not, as like Casperish as I look, this actually is like a huge improvement for me. And I was downgraded from the ICU a couple of hours ago to a step down. So yay. So I'm actually not here so much today to talk to you guys about DK. I'm here to talk to you about what makes a great patient experience. This is paramount. Guys, I don't know if you realize this, but healthcare isn't just taking care of other people. This is a customer service industry, all right? Just like anything else. Our ultimate goal is not only to make our patients and keep our patients healthy, but to make sure that they're happy as well. So, from working in healthcare as long as I have and being a patient as many times as I have, which, by the way, guys, those of you that have to deal with chronic illnesses, with problems, with any parts of your body, not just lazy pancreases like I have, it actually will give you a leg up and will, hello, Mr. McCooey. Guys, that's my wonderful fiance that's checking and saying hi. um, so, um, Chronic illnesses, especially serious ones, you don't necessarily have to look at them as a handicap. I think that being diabetic actually makes me a better healthcare provider because I know what it's like to be a patient. Sandra, hi, nice to see you. Yes, yes, absolutely. I always use, when I'm teaching my students in the classroom, I use my like wacky ABGs and stuff like that. And if you look down a little bit lower in the Medical Divas timeline in the wall, you'll see there is I had put up my numbers from my ABGs and my Venus labs, so you guys could take a look and see what you thought it was going on. And I actually had 4 students that guessed that it was DKA. So like kudos to you guys. Very nice. So I'm going to rattle off a few things that I feel that really truly make a great patient experience. Now, this group isn't just for people who work in offices, okay? This is all allied health, nursing. So this most of this applies whether you're talking about the hospital, which a lot of this is hospital specific, but can be applied to outpatient as well. So the first thing to consider is that your patient knows themselves better than you do. I don't care how many patients with that disorder you've had. I don't care how many patients, that you've seen like this over how many years. They know themselves way better than you know them. Please keep that in mind. Where that really applies in the office is when it comes to phlebotomy. Guys, if your patient is telling you right away, listen, I don't do well being stuck in this place, you're going to have way better luck in this place, please listen to them. They know themselves better than you. Now, yeah, a lot of us like to look around and make sure that, we're going for the best possible vein. But if they're showing you that there's a place that's much better to stick them, go for that because they know, they absolutely know. Okay, so keep that in mind, and that really can apply to so many things. It's not only when it comes to phlebotomy. Number 2, this one is specific to hospitals. In the hospital, patients have very little to look forward to. If they're in the hospital, they're sick, they're in pain, they're miserable, they just had surgery, they are facing something potentially life-threatening. Unless you've just had a new baby, being in the hospital is not a fun thing. It's just not. So, you need to try and capitalize on the little things that actually they do look forward to, and that really makes a huge difference. And the number one thing, and I know so many people are going to roll their eyes, but really is their food tray. Their meals are the only thing they have to look forward to, really, with the exception of visitors. So guys, if your patient wanted tea instead of coffee and the kitchen sends up coffee, go get them a cup of tea. If their order is totally wrong, call the kitchen and make them fix it. Make sure they get their food on time. When the food trucks come up, if you're the one passing the trays, guys, don't look at the food truck and be like, ugh, I'll do it later. I'm taking my break now, or I've got other things to do. No, get their food trays out. It's really important. It's like the only thing they really truly have to look forward to, with the exception of visitors. So please, please, please keep that in mind, okay? Little things like that make a humongous difference. They really do. Whenever you walk into a room where you're taking care of a patient, whether it be an office, hospital room, wherever it is, ambulatory care center, a same-day surgery, please introduce yourself immediately. You know, hey, I'm Kai. I'm your insert title here, and I'm going to be taking care of you today, whether you're MA or nursing assistant or PCT or nurse or whatever it is. Please introduce yourself. And if you have a name tag that has your name on it, given by your organization, please make sure that name tag is flipped forward and they know your name. It really does make a difference when they know who their caregiver is. It makes them feel more secure. Most hospital rooms have whiteboards. Like you can see the one there is my whiteboard. You can see both my nurse and my nursing assistant put their names on the board. I know what doctor is taking care of me. I know who the charge nurse is with her extension, if I should have any problems, who my case manager will be. It shows up there what my diet is. I'm on a carb count diet. It's wonderful um, to be able to see these things, and it gives just that little extra bit of security there. So absolutely do that. Another one, clean your damn hands and your stethoscopes as well, at least once a day, but clean your damn hands before and after every patient. And guys, let your patient see you cleaning your hands. So most hospitals and doctors' offices have the little hand sanitizer, the alcohol Purells or like the foam alcohol on the walls outside the rooms. When you're on your way in, reach your hand out there and grab that, that little spray, the little squirt of the sanitizer in your hand, and be cleaning your hands as you're walking in. So you can do the introduce yourself thing and the clean your hands thing at the same time. Time management, guys, it's a good thing. Go with time management, but let them see you doing it. I know if my caregivers, my nurses, my NAs, anybody who's going to come in and touch my central line, if I don't see them cleaning their hands, they're not touching this thing until I will ask them to clean their hands. So, and I encourage my patients to tell their providers and their caregivers to clean your hands, and if they're offended by you asking them to clean your hands, I tell my patients, then that healthcare provider is in the wrong line of work. Seriously. So reassure your patients. Listen to them. Sometimes they just want to be heard. When there's a problem, when they're afraid of something, when things don't seem right, when they're scared, a lot of times if you're in the hospital, if you're in the back of an ambulance, if you're in an urgent care, if you're in a cardiologist's office, you've got something going on. You're not necessarily having a great day. So, you know, let these patients know that you're there for them. Say, hey, I'm so and so. I'm going to take care of you today. We're going to do the absolute best that we can. I've been doing this for a while. You're in good hands. I promise you, I will take good care of you. If your patient is in a potentially critical or life-threatening situation, guys, please don't tell the patient, it's going to be okay. You'll be fine. Sure, it'll be all fine, because you don't know that. You don't know that that's going to be the case. And don't tell the family members that. What you want to tell them is, listen, they are in great hands. You are in great hands. I am going to take great care of you. You are in fantastic hands. Just, keep reassuring them, I will take good care of you, because we don't know what's going to happen, essentially. So also, when you're treating a patient, guys, especially if that patient's in a life-threatening or critical situation, you're not just treating the patient, you're also treating the family. And when it comes to, more normal situations, pediatrics, that's one where you're not just treating the child, you're treating the family, you're treating the parents. A lot of times parents are, they're scared, they're nervous, there's, things going on that they're not used to. Oh my God, Nava Barkman, do not tell your patient it is your first day. Oh God, this is what happens to my students. I teach them a terrible sense of humor. um, So yeah, you're not just treating the patient, guys, you're treating their family members as well. So keep that, please, please, please keep that in mind. Treat your patient like you want to be treated. If you have ever been a patient in any office, in any hospital for any reason, you know the things that you do and do not like. Honestly, guys, most of us prefer the same things. So think about how you want to be treated and treat that patient like you want to be treated. Also, with the patient experience, please keep in mind that an apology is always appropriate, especially when it comes to, this is, excuse me, specifically when it comes to service recovery. Something went wrong, the patient, the client, the family member is very unhappy. The first thing that you're going to do is apologize, even if this is not your fault. And most of the time, guys, it's not your fault. It's something that was completely out of your hands. But you are the face of your organization, of the institution, of your practice. This thing went wrong and this patient, or client or family member is very unhappy. Geez, I am so sorry about this. I am so sorry this happened to you today. I'm going to do whatever I can to make this better. So tell me what happened and let me figure out how I can help you with this. It goes with that whole thing. Patients sometimes just want to be heard. And there are many times when I've had patients that had situations, scenarios that were really scary and terrible, and they were angry. And sometimes just listening to them solves the problem. An apology is always appropriate. I teach my students that all of the time. You'll hear me say that even more than we live in a litigious society, probably, is the other thing I say all the time. Go above and beyond. There are always little things that you can do to go above and beyond. So when I was a patient care technician at the Valley Hospital in Ridgewood, New Jersey, so many years ago, we're talking like 15 or more years, maybe. I remember I had a patient, I had gotten floated to a med surg floor. And I had this sweet lady that had a wonderful family, elderly lady with daughters who really loved her, and, sons-in-law and grandchildren. And they were just great people. And she was such a sweet dear. But she had very advanced esophageal cancer. And it had gotten to the point where she really could not swallow anything any longer. And she was on hospice, she was on palliative care. We were just trying to keep her comfortable, make those last days of her life more comfortable. So she was in pain all the time with this, big tumor that was closing off her esophagus and was starting to affect her windpipe as well. But as she was a do not resuscitate patient, she had a legal DNR order. We were not going to intubate her or do anything heroic because her chances were not great. So we tried to do whatever we could to try and make her comfortable. So I was actually taking care of that patient, amongst others, on that unit I had been floated to for about 2 weeks, believe it or not. So I figured out by day 3 that the one thing that seemed to relax her, make her calm, make her feel better, was having her feet rubbed. So I would do it a few different times a shift when I had some extra time. And guys, you always have a little extra time to go above and beyond your patient. Don't tell me you don't have time. You do. You have a little extra time there. So it gave her such a comfort, and it made her and the family so happy that I actually got the other 2 shifts, the day shift and the night shift. I was working evenings at the time, to do it as well. About a month after she passed away, her family actually sent the hospital a letter naming those of us patient care technicians that took care of her and were doing these things for her in a letter, and we all got, awards and stuff. And that to me is very, very rewarding work. If you can make somebody's last days on this planet more comfortable, then you have done your job. It's a great thing. Let's talk a little bit about the business end of things. Time management is important, guys, and that always seems to be my one Achilles heel, because I really truly believe that my patients deserve my time. Time management is important, but guys, stop making these patients feel rushed, feel that you don't have time for them, feel that you're annoyed because they're talking and they're trying to get out of there. I know that there's a way to do things, but I have a real peeve when people are making these patients feel that they don't have time for them. We don't need to rush them out. That really takes away from the patient's experience. when you are charting, try and face your patient whenever possible. I worked in practices where the computers, that we have to chart on in the rooms, our backs are to the patient. And I find myself constantly turning around and looking at my patient, and apologizing. Geez, I'm so sorry about my back to you. Please excuse my back to you. But if you ask a question where the answer is longer than just a few words, turn around and look at them while you're getting that answer for them. When they're telling you about their history or why they're there today or why things are going on, turn and look at them. Look them in the eye. Look them in the face. This is really, really important. It shows your patient that you really care. Guys, there is a doc. He's a YouTuber and otherwise, ZDog MD. If you've been my student in the classroom, you've seen many ZDog videos. I think ZDog is brilliant. I agree with pretty much everything that he is out there. And while a lot of his videos are hysterical, they're pretty spot on as well. So he did one recently. It was AMA 06, Why Your Doctor Won't Look You in the Eye. Take a look at that video if you have time. You can actually search him here on Facebook. You can search him here on YouTube. Check out that video. It really puts things in perspective about why we have so little time for our patients anymore, and it's very eye-opening and very candid. And I thought it was fantastic. So take a look at that when you can. One last thing, for those of you healthcare employers, I'm going to give you the secret to a successful and happy patient experience. It's a secret, but I'm going to let it out. Are you ready? Happy employees make happy patients. This is true. In any capacity in healthcare that I have worked, whether it's been EMS, whether it's been hospital, whether it's been physician practice, happy employees make happy patients. Don't bully your employees. Don't put your employees down. Congratulate your employees, give them a pat on the back, give them incentives to work for, and I promise you, your patient experience will go up exponentially. You'll watch those Press Ganey surveys. Scores really soar. All right, guys, so that's about it tonight. I just wanted to do a quick little half-hour lecture. I'm pretty beat, and I'm looking forward to maybe getting some sleep tonight now that I'm out of the ICU and into step down, and I don't have like 5 million fluids and, bags of electrolytes and crap running all the time. So thanks for tuning in with me, and as always, dream big.